Hello everyone, my name is Faisal Nawaz. I am studying LNU, doing BS Biology course. Now I am going to discuss about these videos about mental disorder. The two mental disorders. The first of all, I am going to discuss about the schizophrenia, mental disorder. So what is schizophrenia? Schizophrenia is a serious and lifelong neurodevelopmental disorder that affects how a person thinks, feels and behaves. People with schizophrenia may experience delusion, hallucination, disorganized speech or behavior, and impaired cognitive ability. They may hear voice or see things that are not there. They may believe other people are reading their minds, controlling and thoughts, or plotting to harm them. These behaviors can be scary and upsetting to people with the illness and make them withdraw or extremely agitated. It can also be scary and upsetting to the people around them. People with schizophrenia may sometimes talk about strange or unusual ideas, which can make it difficult to carry on conversations. They may sit for hours without moving or talking. Sometimes people with schizophrenia seem perfectly fine until they talk about what they are thinking. Schizophrenia is not a dissociative identity disorder, formerly called multiple personality disorder or split personality. While some of the signs may seem similar on the surface, people with dissociative identity disorder have two or more distinct identities that are present in and alternately take control of them. So people with schizophrenia may cope up symptoms throughout their lives, but treatment helps may to recover suddenly and pursue their life goals. So what are the signs and symptoms of schizophrenia? It is important to know the signs and symptoms of schizophrenia and seek help early. The signs usually appear between ages 16 and 30. In rare cases, children can have schizophrenia too. Schizophrenia symptoms fall into three categories: positive, negative and cognitive. So what are the positive symptoms? Positive symptoms are referred to as positive because the symptoms are additional behaviors not generally seen in healthy people. For some people, these symptoms come and go. For others, the symptoms become stable over time. These symptoms can be severe but at the other times unnoticeable. The positive symptoms include hallucination, delusions, thought disorders, movement disorders. So what are hallucinations? When a person sees, hears, smells, tastes or feels things that are not real. Hearing voice is common for people with schizophrenia. People who hear voices may hear them for a long time before family or friends notice a problem. Now, delusion. When a person believes things that are not true. For example, a person may believe that people on the radio or television are talking directly to him or her. Sometimes people who have delusion may believe that they are danger or the others are trying to hurt them. Thoughts disorder. When a person has ways of thinking that are odd or illogical. People with thought disorders may have trouble organizing their thoughts. Sometimes a person will stop talking in the middle of the thoughts or make up words that have no meaning. So now what are the movement disorders? When a person exhibits abnormal body movements, a person may repeat certain motions over and over. This is called stereotypes. I'm going to discuss negative symptoms. The negative symptoms refers to social withdrawal, difficulty slowing emotions or difficulty functioning normally. People with negative symptoms may need help to everyday tasks. Negative symptoms include talking in a dull voice, showing no facial expression such as a smile or frown, having trouble experiencing happiness, having trouble planning and sticking with activities such as grocery shopping, talking very little to other people even when it is important. These symptoms are harder to recognize as a part of schizophrenia and can be mistaken for depression or other conditions. Now I am going to discuss about the cognitive symptoms. The cognitive symptoms are not easy to see, but they can make it hard for people to have a job or take care of themselves. The level of cognitive functions is one of the best predictors of a person's ability to improve how they function overall. Often, these symptoms are detected only when specific tests are performed. Cognitive symptoms include difficulty processing information to make decisions, problems using information immediately after learning it, trouble paying attention. Now I am going to talk about the risks of violence. The most people with schizophrenia are not violent. If a person has a symptom of schizophrenia, it is important to help him or her get treatment as quickly as possible. The risk of violence is the greatest when schizophrenia is untreated, since the illness may get worse over time. People with schizophrenia are much more likely than those without the illness to be harmed by others as well as harm themselves. So now I'm going to discuss about drugs and alcohols. What are the important in it is common for the people with schizophrenia to have a problem with illicit drugs and alcohol. A treatment program that includes treatment for both illness and it is critical for the recovery, because misuse of the drugs and alcohol can interfere with treatment for schizophrenia. Drugs abuse can increase the risk of suicide, trauma and homelessness in the people with schizophrenia, as well as increase the risk of development other mental illness. So what are the causes of schizophrenia? So there are many factors may cause schizophrenia, including genetics, environment and disruption in brain structure, brain functions and brain chemistry. So what are the causes of genetics? The schizophrenia sometimes runs in families. However, it is important to know that just because someone in a family has schizophrenia, it does not mean the other members of the family will have it as well. What are the environmental causes? The many environmental factors may be involved, such as living in poverty, stressful surroundings and exposures to viruses or nutritional problems before birth. Disruption in the brain structure, brain function and brain chemistry. These are the causes which disruption could be the result of the genetic or environmental factors, and it may cause schizophrenia. So how schizophrenia is treated? The main types of treatment can help with the symptoms: antipsychotic medication and physiological treatment. So how the antipsychotic medication treats the schizophrenia? Antipsychotic medication help patient with the psychotic symptoms of schizophrenia. Some people have side effects when they start taking medication, but the most side effects go away after a few days. People respond to antipsychotic medication differently, so it is important to report any of these side effects to a doctor. Sometimes a person needs to try several medications before finding the right one. Psychosocial treatment. So psychosocial treatments help patients deal with everyday challenges of schizophrenia. These treatments are often most helpful after patients find a medication that works. Examples of treatment include family education, illness management skills, cognitive behavioral therapy, that's called CBT, rehabilitation, peer counseling, self-help groups, and treatment for the drugs and alcohol misuse. So what are the family education? How they are going to treat? The teachers the whole family how to cope with the illness and help their loved ones. Illness management skills helps the patient learn about schizophrenia and manage it from day to day. And the CBT helps to patient identify current problem and how to solve them. A CBT therapist focus on the changing on the unhelpful pattern of thinking and behavior. Now peer counseling encourages individuals to receive help from the people who are further along in their recovery from schizophrenia. Treatment for drugs and alcohol misuse it is often combined with the other treatments for schizophrenia. So I'm going to discuss about the coordinated specialty care of CSC. The treatment model integrated medication, psychological therapies, case management, family involvement, and supported education and employment services, all aimed at reducing symptoms and improved quality of the life. So the National Institute of Mental Health, recovery after an initial schizophrenia episode. Research project examined different aspects of CSE. The goal of RAISE was help to reduce the likelihood of long-term disability the people with schizophrenia often experiencing, can help them to lead productive, independent lives. Finding them RAISE so that CSE more effective than usual treatment approaches. CSC is more effective when the patient receives coordinated specialty care treatment in the earliest stage of disorder. So the goal of clinic trials is to determine if a new test or a treatment work and is safe. Individual participant may benefit from being part of the clinical trial. However, participants should be aware that the primary purpose of clinical trial to gain a new specific knowledge, so that can be better way to prevent and treat patients of the future. So how can family and friends support their love with schizophrenia? Support system. Supporting to love with schizophrenia can be hard. Can be difficult to know how to respond to someone who makes a strange or clearly false statement. It is important to understand that schizophrenia is a biological illness. So we have to help them with treatment and encourage them to stay treatment. Remember that the benefits of the hallucinations seem very real to them. Be respectful, gently supportive, empathetic, and kind of without tolerating dangerous or imperative behavior. So now I'm going to discuss about the second mental disorder that called mood depressive disorder. So what are the mood depressive disorders? Moods, prevailing internal emotional state, and what's the effect? The external display of feelings. The mood disorders are category of illness that describe a serious change in mood. So what are the classification of mood disorders? Depressive, unipolar, and bipolar, and etiologic. Major depressive disorder and the semantic. So we will discuss about in depressive, what are the major depressive disorder, the semantic disorder, in bipolar 1, bipolar 2, and cyclothymic disorder. So what are the major depressive disorder? Among 5 most common disorder, these are among the most 5 common, and lifetime prevalence is 5 to 20%. Female to male ratio is 2:1. The incidence rate is greatest between age 20 to 40. Major cause of disability and suicide. What are the etiology of this disorder? What are the biological factors? The more common in monozygotic twins, unipolar depression in parent, abnormalities in amine neurotransmitters, neuroendocrine abnormalities in hypothalamic pituitary adrenals axis. And what are the physiological factors? Major life events like intrapersonal relations, absent or unsatisfactory significant special bonds have negative effects on self-regards, rapid hormonal changes, distorted thinkings, lose hopefulness. So how to diagnose these mood disorders? Criteria for the major depressive episode that are more or of the following at least 2 weeks, like depressed mood, anhedonia, sleep disturbance, guilt, appetite, energy, concentration, psychomotor, and suicidality. So how we are the criteria, the major depressive that are more or following at least 2 weeks, that are the mood, sleep, interest, guilt. These are the diagnosis, how to differential diagnosis, like other psychiatric disorders, sleep disorders, and neurological disorders, endocrine disorders, metabolic disorders, hematological disorders, inflammatory conditions, infections, medication related like antihypertensions, steroids, substance misuse. These are the how to diagnose this disorder. For investigations, there are no specific tests. Investigations focus on exclusion of treatable cause or other secondary problems. A standard tests are complete blood pictures, ESR, thyroid function test, glucose level, calcium level, liver function test. Investigations only if indicated by history and or physical signs like urine or blood toxicology, breath or blood alcohol, ABG, thyroid antibodies, anti-nuclear antibodies. So what are the role of the management? So hospitalization if there is, the serious risks of suicide, serious risks of harm to others, significant self-neglect, severe depressive symptoms. This is initiations of ECT, treatment of resistant depressions. So any other treatments, like the first line of treatment is antidepressants. Effective is 65 to 75% of patients. The decision of choosing antidepressant depends on the patient factor like age, sex, comorbid illness, previous response to antidepressants, symptomatology, sleep problem like lack or energy of hypersomnia, OCD symptoms, example tricyclic. Now what are the selective serotonin reuptake inhibitors? How to diagnose this one? If the first treatment is failed, there is a second line treatment. When the first line is treatment failed, unacceptable side effects from the first line drug, change of antidepressants of different class or the same class to different side effect. The treatment called electrocompulsive therapy may be used when there are severe biological features, reduce or marked psychomotor radiators. What are these symptomatic disorders? These are the mild chronic depression for at least 2 years, common psychiatric comorbidities, major depression up to 75%, and double depression, anxiety disorders, personality disorders 20 to 40%, somatoform disorder 2.8 to 45.2%, substance abuse up to 50%. So what are the bipolar disorders? In the mood disorder, the bipolar disorders are known as the manic depressive illness or a brain disorder. A brain disorder causes unusual shifts in mood, energy, activity levels, and ability of carry out day-to-day tasks. Types: there are 4 types: bipolar 1, bipolar 2, cyclothymic disorder, and other specified or non-specified bipolar and related disorders. What are the symptoms and signs? The symptoms and signs are the feel very up or high or elated, a lot of energy, increased activity levels, trouble sleeping, talk really fast about a lot of different things, be agitated, irritable or touchy, feel like their thoughts are going very fast, think they can do a lot of things at once, do risky things, feel very sad, down, empty or hopeless, decrease activity levels, feel worried and empty, trouble concentrating, forget things a lot. And now what are the bipolar first disorder? The first episode of mania usually occurs in early 20, the most likely associated with comorbids, substance abuse or dependence. So how is the bipolar diagnosis? The diagnosis like distinct period of elevated, expansive or irritable mood at least 1 week. 3 of the following if the mood only irritable: self-esteem, sleep and thoughts. The substance-induced mood disorder and mood disorder secondary to medical condition are the essential differential diagnosis: endocrine disorders, neurological conditions, systemic disorders, drugs and recreational drugs. What are the risk factors of this disorder? Brain structure and functioning, genetics, family history, substance abuse, negative life events. So what are the managements? That are hospitalizations, pharmacotherapy, mood stabilizers, antipsychotics, electroconvulsive therapy ECT, preventions of relapses, prophylaxis, therapeutic alliance, and family educations. Psychotherapy. Some psychotherapy treatments used to treat bipolar disorder include cognitive behavior therapy, CBT, family focused therapy. Thank you.